Are your kidneys sending you SOS signals? Today, we're breaking down the mysterious signs that you may notice in your body if your kidneys are not working quite as they should. Hey there, thriving beings! Welcome back to our Sanctuary of Wellness. Today, we're diving into a topic that's often whispered by our bodies but rarely understood: our kidneys. These unsung heroes work tirelessly, sifting through everything we consume, from that kale smoothie to the last sip of almond milk latte. But sometimes they wave little red flags, signaling a cry for help. And because we're all about thriving, not just surviving on our journey, it's crucial we pick up on these signals. So, are you ready to decode the secret messages from your kidney duo? Let's explore the 13 warning signs that your kidneys might be trying to get your attention. It's time to tune in and turn up the love for these vital organs. But hey, before we dive into the kidney pool, let's make sure you're part of our Thriving Beings family. Hit that subscribe button and bell icon so you won't miss out on our weekly dose of health enlightenment. Now, let's get to it and uncover these signs, shall we? Sign number 1. Unusual fatigue. When our kidneys are in top shape, they filter out waste and extra fluids from our blood, keeping our body in a harmonious state. However, when they're not functioning optimally, they can't do their job effectively. This can lead to a buildup of toxins in our bloodstream, which can cause a profound sense of fatigue. This isn't just the usual tiredness after a long day, it's a deep, bone-weary exhaustion that doesn't go away with rest. The kidneys also have a lesser-known but equally vital role in our body's production of red blood cells. They produce a hormone called erythropoietin, which signals to our body to make red blood cells in the bone marrow. Red blood cells are the carriers of oxygen to all parts of the body, which is essential for energy and vitality. When kidney function is impaired, the production of this hormone drops, leading to a decrease in red blood cell production, a condition known as anemia. This anemia can leave us feeling drained and weak, as our body and its organs aren't getting the oxygen they need to function properly. Sign number 2. Persistent chilliness. Moving on to the second sign, persistent chilliness can be a direct result of this anemia. Even when you're in a room comfortably warm for everyone else, you might find yourself reaching for a sweater. This persistent feeling of being cold when your kidney function is impaired is due to the lack of red blood cells in your circulation. Without enough of these cells, your body can't transport the heat as well as it should, leaving you feeling perpetually cold. Sign number 3. Breathlessness. The third sign, breathlessness, can also be a consequence of impaired kidney function. Often, people attribute shortness of breath to problems with the heart or lungs, but the kidneys play a role here too. When they're not working correctly, fluid can build up in the lungs, making it difficult to catch your breath. Additionally, anemia associated with kidney dysfunction means less oxygen is being transported in your blood, which can leave you gasping for air even after mild exertion. Sign number 4. Skin changes. Now, let's talk about skin changes, specifically itchy and dry skin. Healthy kidneys do an incredible job of balancing minerals and nutrients in the body, which in turn keeps the skin moist and healthy. When there's an imbalance due to poor kidney function, it can lead to dry, itchy skin. This isn't the occasional itch relieved by a dab of lotion. This is a persistent itchiness that doesn't go away, a sign that there may be a deeper issue at hand. Sign number 5. Swelling of extremities. Swelling of the extremities is a common yet often misunderstood sign that your kidneys may be in distress. This swelling, medically known as edema, occurs when your kidneys are unable to perform their crucial function of removing excess fluid from the body. As a result, this fluid accumulates in the tissues, particularly in the lower extremities such as the ankles, feet, and hands, causing noticeable swelling. It's not the typical slight puffiness one might experience after a long day on their feet. This is a persistent and abnormal swelling that doesn't dissipate with rest or elevation. Sign number 6. Puffiness around the eyes. The sixth sign that your kidneys are calling out for help is puffiness around the eyes. This specific type of swelling is indicative of protein leakage, a serious red flag when it comes to kidney health. Under normal circumstances, proteins are too large to pass through the kidney's filtration system and are retained in the blood. However, when the kidney's filtering units are damaged, protein can seep into the urine, leading to a deficit in the body. This protein loss can cause fluid to leak into the surrounding tissues, as proteins in the blood tend to pull water into our blood vessels, acting like a water magnet. When the level of protein in the blood is low, water may leave the blood vessels and collect in the tissues, leading to puffiness, particularly around the delicate area of the eyes. Sign number 7. Metallic taste. Moving on to the 7th sign, changes in taste and breath can also be a sign of kidney trouble. A metallic taste in the mouth is a distinctive symptom that can be attributed to the accumulation of toxins that the kidneys are unable to filter out. This unpleasant taste can significantly affect your appetite and enjoyment of food. In addition, bad breath is another symptom that can be associated with these toxins. When the kidneys fail to remove waste products from the blood, the breath can take on an ammonia-like odor, which can be both unpleasant and persistent. Sign number 8. Urine alteration. The 8th sign involves alterations in urination. Your kidneys are responsible for the production of urine, and any changes in this process can be an early indicator of kidney issues. These changes can include an increase or decrease in the frequency of urination, the need to urinate more often during the night, or a noticeable change in the color and consistency of the urine. For instance, urine may appear foamy if there is protein in it, or it may have a darker color, which can indicate the presence of blood or a high level of waste products. Sign number 9. Sleep disruptions. Sleep disruptions can be a significant indicator that your kidneys are not functioning correctly. When the kidneys are healthy, they filter and remove waste from the bloodstream, which helps maintain a balanced internal environment conducive to restful sleep. However, when their filtration is compromised, toxins accumulate in the blood, and this can lead to sleep disturbances. One such disturbance is sleep apnea, a condition characterized by pauses in breathing or shallow breaths during sleep. While sleep apnea can be caused by various factors, its presence in someone with kidney dysfunction may be a result of the body's struggle to manage the toxin overload, which can interfere with the respiratory system during rest. Sign number 10. High blood pressure. The 10th sign of potential kidney stress is persistent high blood pressure. The kidneys have a role in regulating blood pressure by controlling the volume of blood and the extent of arterial vessel constriction. When they are damaged, they may not function properly, leading to an increase in blood pressure. This is not just a one-time spike in blood pressure, it's a consistent issue that can cause further damage to the kidneys, creating a vicious cycle of kidney stress and hypertension. Sign number 11. Nausea and appetite changes. Moving on to the 11th sign, nausea and changes in appetite can also be symptomatic of kidney issues. As the efficiency of the kidneys declines, they become less able to remove waste products from the body. This buildup of toxins can lead to a feeling of constant nausea, which can significantly reduce the desire to eat. The decrease in appetite can be gradual, and the persistent nature of nausea can lead to a general aversion to food, contributing to nutritional deficiencies and weight loss. Sign number 12. Cognitive difficulties. The 12th sign that your kidneys may be signaling for help is the onset of cognitive difficulties. When kidney function is impaired, there is a reduced capability to filter out toxins from the bloodstream effectively. These toxins can accumulate and have various effects on the body, including the brain. One of the primary cognitive symptoms individuals may experience is a noticeable difficulty with concentration. Tasks that once seemed simple can become challenging, and maintaining focus during activities can be a struggle. This is not merely a case of being distracted or having a lot on one's mind. It is a persistent problem that can affect both work and personal life. Sign number 13. Muscle cramps. The 13th and final sign on our list is the occurrence of muscle cramps. These cramps are not the typical muscle soreness one might experience after a vigorous workout or a long day on their feet. Instead, they are often a symptom of electrolyte imbalances in the body, which are closely regulated by healthy kidneys. The kidneys play a crucial role in maintaining the balance of minerals and electrolytes such as sodium, potassium, and calcium. When kidney function is compromised, this balance is disrupted, leading to involuntary muscle contractions or cramps. These cramps can be sudden, severe, and recurrent, and they can occur in various muscle groups throughout the body. And there you have it, thriving beings. 13 telltale signs your kidneys might be sending out an SOS. Remember, these little bean-shaped buddies are the silent guardians of your well-being, and it's our duty to listen and respond with care. From staying hydrated with clean water to indulging in a rainbow of fruits and veggies, your lifestyle choices can be the best form of love you show your kidneys. Don't wait for the little signs to become a shout. A whisper is all you need to take action. If ever in doubt, have a chat with your healthcare professional to make sure everything is working as it should. Keep thriving, keep loving your body, and most importantly, keep listening to what it's telling you. Before you go, give this video a like, share it with your fellow thriving beings, and if you haven't already, subscribe to stay updated with the latest wellness wisdom. Until next time, keep thriving.